HIV stigma in a healthcare setting is when healthcare professionals hold and express negative attitudes and beliefs about people living with HIV. A UK study reported that 8% of people living with HIV feel that they have been treated differently from other patients, and 5% feel that they have been refused healthcare or had a treatment or medical procedure delayed due to their HIV status. Here in the US, more than a quarter of people living with HIV report feeling stigmatized in healthcare settings. This can show up in many different ways, such as providers refusing to touch patients or perform physical exams, using excessive precautions, making judgmental assumptions about a patient's lifestyle, or denying care altogether. HIV-related stigma appears to be most widespread in southern U.S. This region accounts for nearly half of new HIV infections in the U.S. and also has the highest death rates related to HIV in the country. In a survey completed by more than 700 healthcare workers in the southeastern states, 30% of respondents said that people living with HIV could have avoided it if they wanted to. And 10% said that people living with HIV should feel ashamed of themselves. Most respondents were from urban healthcare centers, which demonstrates that this stigma doesn't only exist in rural areas. Respondents to the survey included clinicians, clinical support staff, social and community workers, and administrative staff, showing that stigma can exist across all roles in healthcare. HIV stigma can pose serious obstacles for people living with HIV when trying to access healthcare. Expecting or experiencing stigma from healthcare professionals can discourage people from getting HIV care by acting as a barrier to testing, medication adherence, and ongoing care. Studies show that people who feel a high level of HIV stigma are more than twice as likely to delay seeking HIV care compared to those who feel less stigma. It can lead people to internalize stigma and experience poor mental health, which can negatively affect their quality of life. Healthcare methods that focus on what patients need, like telehealth and at-home self-testing, can be really helpful for people who might avoid seeking care because they fear being judged for living with HIV. But to tackle stigma once and for all, healthcare professionals must have an accurate understanding of HIV transmission and prevention to help reduce barriers to HIV care and treatment.